What are the things that determine whether you are having a high-risk pregnancy? We look at three things. We look at your previous pregnancy history, at your current pregnancy history, and we look at the medical conditions that you have. So when it comes to your previous pregnancy history, you are having a high-risk pregnancy if you have given birth to a stillborn or lost your baby shortly after you gave birth, if you have had 3 or more consecutive miscarriages, if you gave birth to a baby that weighed less than 2.5 kg, or you gave birth to a baby that weighed more than 4 kg. If you had preeclampsia or any hospitalization for preeclampsia in your previous pregnancy, and if you've had previous surgery like a cesarean section or a cervical cerclage or a myomectomy. So when it comes to your previous pregnancy history, those are the things that put you under the high risk classification. What puts you in the high risk category when it comes to things that are happening during your current pregnancy? So it's things like being pregnant with twins, multiple pregnancy, you are high risk. If you are pregnant and you are less than 16 years of age, or you are more than 37 years of age, if your blood group is Rh negative and you have antibodies, if you have vaginal bleeding in the current pregnancy, if you have a pelvic mass that is palpable while you are pregnant, possibly could be fibroids that are palpable and can be felt on your abdomen, and if you have a diastolic blood pressure of more than 90 at your first booking visit, and the diastolic blood pressure is the number that is below on your blood pressure reading. We don't want it to be more than 90. So if you develop any of these things in your current pregnancy, they put you under the high risk classification going forward. And then what are the medical conditions that put you under the high risk pregnancy classification? If you have diabetes, high blood pressure, epilepsy, asthma, TB, or if you use substances like alcohol or smoking, and also if you have any other severe medical condition that is uncontrolled, then you will be under the high risk classification. And then how can you know if you are having a low risk pregnancy? Number one, if you are between the ages of 17 and 36, you don't have any medical conditions, it's your first pregnancy, or if it's not your first pregnancy, you never had any complications or hospitalizations in your previous pregnancies, and you don't have a risk of more than 3 recurrent miscarriages, then you are low risk and you can attend with a midwife. If you are high risk, you need specialist care, which is care with a gynecologist, obstetrician, and obs-gyne. But if you are low risk, then it means you can attend with a midwife throughout your pregnancy.